When I was younger, my mom suffered a liver issue from taking birth control pills in the 70s. I won't go into a lot of detail on it, but just so you have an understanding, from her thighs to the tips of her toes, she always had a tingling feeling like they were asleep every day. It also caused her to have seizures, so she was on medication to help with those. I was young and didn't really understand her everyday struggle just to maintain a somewhat normal life. As I got older, I started looking back on the hard times she had with health care, getting the quality of care she should have been receiving. My parents had difficulties finding health insurance because of pre-existing conditions. Even when they could find insurance, it didn't always cover the existing conditions. I never understood the sacrifices they made to keep my sister and myself in the dark about some of the problems so we could be kids and enjoy our life. I am interested in the psychological side of humans. After I started studying different mental illnesses, I realized that my mom suffered from major depression. This was never addressed from any of the numerous doctors she went to for her health issues. I now question that many doctors did not recognize the depression and help cure some of her underlying illnesses that could have been causing the physical issues to be worse. The quality of health care she received is really questionable, and there was nobody there as her advocate on ensuring everything was being done. So with the cost of health care soaring, why are we not receiving the quality of care to offset the cost? In 2004, the U.S. healthcare spending increased 5.3% following growth of 2.9% in 2013 to reach $3 trillion or $9,523 per person. With this type of spending, we should be in the best place in the world to receive health care, but we're not. The U.S. is not even in the top 25 systems in the world. According to the World Health Organization's ranking, the world's health systems, the U.S. is ranked 37th, but ranked first in healthcare spending in the world. The primary care physician should be the point of contact for their patients. If we had one healthcare professional as a point of contact for a patient, there would be more organization for the patient. There would also be one person making sure that the procedures are done that are needed and not a repeat of something that's already been done by another specialist. Having a healthcare professional as an advocate for a patient would increase the quality of care. Currently, patients or their family are the only real advocate they have to speak out or question healthcare professionals. This causes unnecessary stress on the patient and family when trying to deal with a serious disease or illness. Having a healthcare professional as an advocate, speaking for the patient, and having the medical knowledge to question procedures would reduce the stress and relieve some of the burden of the patients and allow them to focus on getting better and not always just what do we do next. I feel that if my mom would have had a healthcare professional being an advocate and a point of contact for her, she would have recovered more than she did. It is time that the healthcare system got back to healing the patient and being a major driving factor and not what procedures they can do regardless if it is necessary or not. This is just added stress for the patient. Having a PCP as a patient advocate or point of contact would reduce the unneeded procedures and increase the quality of care for the patient because it would reduce stress and make sure they got the correct procedures. In turn, this would reduce some healthcare spending on pointless procedures and give the quality of care we all deserve. Thank you for listening and have a great day.